With hair restoration, it's actually become a new tool that we have utilized. In hair restoration, it's a really great tool for a specific type of patient. I make this distinction, okay, because PRP is not a way to restore hair where it has now been gone completely. Meaning, if your scalp is bald and shiny, that hair's gone. PRP is not going to regrow it, it's not going to regenerate it. You need a hair transplant in that area. But if you have thinning of your hair, if you have mild to moderate male or female pattern baldness, right? So androgenic alopecia. If you have, let's say, postpartum hair loss, okay? If you have maybe issues with alopecia areata, we're starting to find some evidence that there are benefits with PRP treatment, though those treatments are a little bit unpredictable. But we are finding that those who are having thinning of the hair, that the way the PRP works is that it allows for stimulation of dormant hair follicles, it prolongs the hair growth cycle, and it increases the density and thickness of those hair follicles. This allows for a decrease in the need for a hair transplant, or at very least a prolonged period before you may eventually need a hair transplant. It's also a procedure that has essentially no downtime. You can go and get your PRP treatment and go about your business essentially right away. For those of you who have had a hair transplant, PRP is a great way to maintain those grafts. So PRP allows for angiogenesis, creation of new blood vessels in the area where it's injected. And by improving blood flow to those grafts, you maintain them and keep them nice and healthy, allowing you to essentially maintain your investment. If you combine PRP for hair restoration with other things like minoxidil use or finasteride use or dutasteride use, you're really giving yourself the best chances for prevention of hair loss. Now, the treatment protocol for PRP for hair is essentially one treatment every month for 3 months, one treatment every 3 months for the next 3 treatments, and then one treatment every 6 months moving forwards. Now, because this is an issue of hair loss, as we know, hair loss is a chronic issue, and the treatment for it needs to be continuous. Nothing in hair is permanent except for transplant.